Welcome to the Deep Dive. Today, we're tackling something super relevant if you're in healthcare, maybe thinking about a move. The Dubai Healthcare Authority license, the DHA license.
Hmm.
It's not just, filling out a form. It's quite a specific journey. We've gone through the sources to pull out the absolute must-knows, the key steps, maybe some surprises to get you up to speed fast.
That's right. And the DHA license itself, it's essentially Dubai's way of verifying healthcare pros. We're talking doctors, nurses, pharmacists, allied health, everyone.
Making sure they meet Dubai standards.
Exactly. It ensures they can practice safely there. It's really seen as a solid benchmark globally.
Okay, so let's unpack this.
Sure.
How does someone actually, start this? It seems like there's a clear path laid out.
There absolutely is. Step 1. Create an account on the DHA Sharing portal. That portal. That's your command center for pretty much the whole thing.
Right.
Once you're set up there, the very first and really crucial step is checking your eligibility. Are you even qualified to apply?
And what does that usually involve for, say, a nurse?
Yeah, good example. For nurses, typically you need about 2 years of clinical experience after you register. And here's a key detail a lot of people miss.
Uh-huh.
That experience needs to be fairly continuous. Generally, no more than a 2-year gap in practice. Plus, your degree has to be from an institution the DHA actually recognizes.
Okay, makes sense. They want competence and recent practice.
Yeah.
So eligibility is confirmed. Then what? Paperwork, I assume?
Yeah, well,
Lots of it.
You guessed it. That's the next phase. Document prep. And it is critical. You'll need scanned copies, color copies usually, of things like your passport, your nursing degree, your transcripts.
The official records.
Exactly. Also, your valid license from your home country, like the PNC if you're coming from Pakistan. And one that's really important, the good standing certificate.
Ah, right. That proves you don't have disciplinary actions.
Precisely. It's from your current licensing body. Plus, you need letters proving your employment experience. And here's a big one. Everything must be in English or Arabic.
Or legally translated.
Or legally translated, yes. Get that wrong, and things grind to a halt. It's almost like a scavenger hunt, professionally speaking. Missing just one thing can really delay you.
So attention to detail is key.
Mm-hmm.
Okay, documents submitted. Now, I've heard this next part can be, well, a bit long and maybe stressful. Primary source verification, PSV.
Yes, PSV via a company called Dataflow. And you heard right, this often takes the longest and can be nerve-wracking. It's where things get really interesting, as you said.
Why is that? What are they actually doing?
Well, Dataflow doesn't just look at your documents, they go directly to the source. They contact your university to verify your degree, your previous employers for your experience, your home licensing body.
Wow, okay. They check everything.
Everything. It usually takes anywhere from 2 to maybe 6 weeks, sometimes longer. And there is a cost, roughly AED 1,000 to 1,300, give or take.
So it's a proper background check, professionally speaking.
It really is. Dubai's not just ticking boxes, they're verifying the actual legitimacy of every credential. It's all about patient safety and trust in their healthcare system. It's quite a benchmark, actually.
That level of detail definitely says something about their standards. Okay, so Dataflow gives the thumbs up. What's the next hurdle? The exam. Prometric.
Correct. Once Dataflow clears your verification, you get an eligibility letter. Think of it as your ticket to book the DHA exam, which is run by Prometric.
And what's that like?
It's a computer-based test, multiple choice. For nurses, the fee's around $250 to $280 USD. You're looking at maybe 70 to 90 questions. And you need to score typically 60–65% to pass.
Seems straightforward, but exams are always pressure situations.
They are. The good news is they have testing centers all over the world. Pakistan, for instance, has centers, so it's accessible.
Okay, great. Pass the exam. Nearly there. What's the final piece to actually start working?
The last main step is getting a job offer from a facility that's approved by the DHA.
So you need the job offer before the license is fully active.
Exactly. Your employer, the hospital or clinic, is actually the one who applies for your license activation. Once they do that and it's approved, you get your official DHA license. Then you can start your job.
Right. So bringing this all together, what's the big takeaway for our listeners?
Well, if you look at the whole process, all these steps, it really highlights Dubai's serious commitment to high healthcare standards. It's about ensuring quality and patient safety through a, frankly, quite robust international verification system. It builds trust.
Yeah, absolutely. And hopefully this deep dive gives you, our listener, a clear roadmap. We've tried to cut through the noise, give you the essential facts, save you some time wading through all the info online.
And perhaps it leaves you with a thought. Beyond just following these steps, what does this kind of meticulous process tell us about where global standards for healthcare professionals might be heading? And how could that influence your own career path, even if Dubai isn't your immediate destination? Something to think about.